Coronavirus cases are rising here in Northeast Ohio and around the country.
Yeah, for the first time in weeks, the Ohio Department of Health and the White House Coronavirus Task Force briefed the media today, but the concern remains mostly for the future. Our Sarah Shookman joins us now, and the numbers are definitely going up at this point, whether they're being reported daily anymore or not.
Absolutely, yeah. And with both of those briefings being called today, Jay and Betsy, we got a little nervous. Like, what is coming out? What are we going to hear? But the message from both camps was really consistent. COVID is circulating. They're watching that closely, and they are trying to prepare for the fall. Now, despite a significant number of cases, severe cases and hospitalizations here in Ohio remain stable, and deaths have actually declined over the past 3 weeks. Dr. Bruce Vanderhoff says this is a sign that immunity is working from vaccines and from prior infections, and that access to therapeutic options is now great. In fact, the White House reports that prescriptions for the antiviral Paxlovid are up fourfold in just the last month.
All good tools, which we need to combat this thing, but I keep hearing there's major concern for the fall. Why is that?
Yeah, everybody's talking about fall, and the concern is nobody knows what fall will bring. There is some research to suggest that the coronavirus is seasonal, like some other respiratory viruses, and the high levels of virus circulating now could be creating new variants to take over in the coming months.
We're all anxious about those next variants. Are they going to continue to become more mild variants, which would be great? We would love that. Are they going to mutate backwards and become more pathogenic? Are they going to continue to become more pathogenic in children? Is this going to shift from an adult virus to a pediatric virus? So I think a lot of us are kind of holding our breath, like, what's going to come next? Because we don't really know.
We love Dr. Amy Edwards from UH, and she is pretty blunt about it. She says, everyone is going to get COVID. Do you want as much protection as you can have going in, being vaccinated and boosted, or do you want to take your chances and risk side effects and complications? That's what she deals with day to day in her clinics. And if you are particularly high risk, now would be a good time to make that plan for what you're going to do when you test positive.
Yeah, so what about kids in this? I mean, that's her specialty, but,
right? Yeah, and that's the big concern here. Of course, yesterday, boosters were approved by the FDA. The CDC considers those for the 5 to 11 age group tomorrow, so that could happen as early as this week. Once the vaccines are available for kids under 5, which has been the big question mark a lot of us parents are concerned about, that's still looking likely for late June, early July. But then protection would be available for pretty much everybody. It's just getting people to take it.
Well, fall's that time when we all come back together and go inside and get close.
And that's the concern too. Summer at least gives us some protection of being outside and some of the ventilation and things that we know help.
It's interesting, cases are up and we know that, but it's estimated that cases are up far more than we even know.
Yes.
Because testing, people just feel like it's part of their more routine now. And so the fact that hospitalizations and deaths are down is really a testament to the vaccines doing their job. They're supposed to keep us from getting sick and keep us from dying.
And get that treatment if you need it. When you get sick, talk to your doctor quickly thereafter, because those options, they're out there now. It's easy to pick up at CVS. That didn't exist months ago.
Wow.
Yeah.
It's come a long way.
Like getting a sinus infection.
That's right.
Go get the stuff and it's all better.
Take care of it.
Awesome. Thanks, Sarah.